does a simple low dose of resveratrol, the one found in red wine, and a little bit of copper impact glioblastoma, brain cancer tumors. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years. There was an interesting study that was actually published of all journals, Nature, a pretty reputable journal, and it was actually done out of India, where they had groups of patients who've been diagnosed with glioblastoma, brain cancer, and they were going to have surgery. And they took 10 patients and they gave them resveratrol, and it was actually a very low dose. It was 5.6 milligrams of resveratrol. And they also gave a very low dose of copper, like basically half a milligram, 0.56 milligrams of copper. They dosed this 4 times a day in these 10 patients. And then they were on it for about 11 days or so, 11.6. And they had the surgery and they analyzed it compared to those who did not. And what they found is basically features that the glioblastoma cancers was actually less aggressive in a bunch of features, which honestly for me is very shocking and surprising. And they've done some other work in head and neck cancers that was been published a couple of years ago as well. And so, and basically what they're saying is, and this is a new area for me, is that they feel it's targeting something called cell-free chromatin particles. And these particles, what happens in cancer cells is that, say, when they die, they in essence infect normal cells and assist in their transformation to becoming cancerous. So they're hypothesizing that this cocktail of copper and resveratrol helps to neutralize that, which in turn calms down these aggressive features of these cancer cells. So definitely a new one for me. Again, it was published in Nature in September of 2025. Look forward to seeing how this could translate. So we don't know, obviously, if this is true. What does it do to glioblastoma? These patients typically do chemotherapy, temozolomide, these pills, radiation. What does it do with that in their responses, survival? Obviously, this is the wild, wild west. But this article was forwarded to me by a colleague, and it's been kind of circulating amongst my peers. And so I thought I'd share it all to you.